So my name's Lucy Rigby, and I've been in the mental health services since I was 17 years old. So that's 20 years now. First ever Harplin's admission was the second week it opened actually, and I went there. And then since I've had different experiences, generally in hospital quite an amount of time, been in a resource centre a few times that used to be called the Bennett Centre. My diagnosis basically is quite complex, as people call me, because it's more than one thing. I have been diagnosed with paraschizophrenia. I'm on antidepressants and anxiety medication. I've got quite bad OCD, and I've also got diagnosed, I think it was early last year, for PTSD, because over my life there's been I've moved around as well from place to place. I've just had a very, very bad experiences, a hell of a lot that's happened all these years. And it's just all sort of, it just builds up, and then they end up getting sectioned and going to hospital. So it isn't like one thing that sort of triggered it, it's a collection of things, and over the years it's just really bad things that have happened really. That I find it hard to cope with. I've had quite a few things done. I've had a lot of neuro tests done on my brain and things. I've had also, they provided sort of holistic therapies there a few years ago, what I don't think they're particularly doing now. And the lady sort of did like acupuncture and things at the time. And like proper relaxation, which I thought was quite good. All the times I used to go into hospital, I used to apparently say to my mum, I hate the staff. She says, but then when you get well, Lucy, you love the staff. But it was sort of years ago, it was old school really. It was like, there was like, especially the healthcare, because the nurses had been in the office quite a bit. But the healthcares were older. And there was a couple that was sort of like matron style staff. And they'd have like put things in place, like you had to strip your own bed on a Saturday. And they also used to say, you're not coming outside of your room until you've got something on your feet. And at the time we were thinking, shut up and, that type of thing. But I do feel that was the best way for us. Bit of structure, I think. But like, there was especially these two women who nursed me, and I used to call them my fairy godmothers for some strange reason. And they could be pains, but it was better. In the experience as well, I've had 4 full courses of ECT, run by a man named Dr. George, and he was the fantastic doctor ever. Again, he was old school, and he was fantastic. I'm not sort of saying, get rid of all the young ones and get the older ones out, but I just feel like I keep saying there's something missing. That sort of special ingredient is missing, but I can't sort of say what the answer is really. But it's like the staff who found out that, you're there, and I knock on my room one night, and it was a night shift. He says, hi Lucy, I would say it's nice to see you, but not in these circumstances. And, when you've got people like that who nurse you when you're younger and come and check on you, looking after you, they say, and, it's that kind of thing that makes you feel so nice. It's a bit of comfort in a way. Seeing a family face and they're quite nice to you because you're going through hell in your mind. Then you've got that bit of comfort, and with regards to staff, my support workers, I've got Anne Hill and I've got Jackie at the 24/7 and I've got Jo as a careco, and I honestly call them my dream team because they're so good with me, because they know how to act with me. Anne knows me inside and out, knows where I'm confident. They've just got the knack. They've got something there. They know how to talk to you. They know how to treat you. It's like if you're out of order, they'll tell you. And then you think, okay, yeah, sorry. But I don't know. it's like me and we just have really good chats. And I feel like I can tell them anything because I have such horrible thoughts and it makes me feel really low. And you can't always disclose them to your mum and dad. But with Anne and Jackie, as soon as I answer the phone or they look at me, they know straight away. So I don't know how they did it really, but you could do with them being in the hospital. In some ways, if you've had it so long, you sort of know how to cope with it a bit better. But I think there needs to be something more when you leave hospital that is there. It's like the clubhouses. I go to the 24/7. Obviously, that's been shut for a long time. But I think like there needs to be like places where you could go and, I don't know, just more sort of interaction. And I mean, years ago, I'm sure there used to be like a walking group. And I think we used to get on a bus, a few of us, and go somewhere on the bus for the day. And, you know, I mean, could that be made aware to some others who are entirely on their own? Because a lot of people with mental health have got a free bus pass. Because, I mean, in my case, my medication knocks me out. I wouldn't be able to drive. And I don't know, just things like that. And I think we went to Stafford one day, and this was years ago, went like in a cafe and had a bit of dinner, and it was just nice to interact with people, especially on a weekend, because if you go to a group in the week and then you go from Friday till Monday and you're not too clever and you just need a bit of morale, it's a long weekend. It really is. Yeah, the home treatment team, basically, that's the times particularly when I have been sectioned, because the last time I refused to do anything with the home treatment, I found in a lot of other people, patients as well, who have known over the years, I've still got the negative thing against them because they're unreliable. Sometimes they say, oh yes, we're coming such a date. Then they ring you, oh we're not coming, just a telephone. Well, anybody can speak on the phone and have a nice voice, but somebody could be sitting down on the phone, rocking and doing all sorts. You know, how can they make sure you're all right when they're not physically there looking at you? Do you know what I mean? And also, like, when they do come, you feel like you're being rushed. It's like the same direct question, and they just want to be in and out. I don't know if it's because of how they are or the caseload again, but you know, it's not very good really. Like I said, mostly cancelled appointments, or they just come to you for 5 minutes and then they're out the door again, and you just think, oh, they mustn't be that interested. Not that you want attention, but it's always nice to try and have a talk to somebody to get it off your chest, and they just appears that they haven't got the time. When they are qualifying people and things, how do they know that person is right for the job? You know, it's more than sort of paperwork. It's got to be character as well as the person. And I don't see them making time to make appointments with nurses and healthcares to get that sort of inclination when you're in a conversation with them. So basically, they're just getting the jobs because of the written down credentials. Bugger what type of person they are inside. So I think that's important, and there should be something like some kind of, maybe like a patient regulation scheme, whereas obviously we wouldn't go into personal things of nurses and things, but things that we could that they could come to us, like if we have like a patient group, they could come to us and we could sort of not scout them, but sort of, you know, it's a bit like if they gave them the option, would you like to go see like a patient's meeting where you can go in and meet the patients? They can tell us what their experience, what they want. And then we could maybe be sort of a little bit more involved more.